Well, Donald Trump may have paused his planned tariffs for 90 days, although he's left a base in place. But industries are beginning to worry, and one of them that he's targeting is pharmaceuticals. There's a double-page spread in the Sunday Telegraph today. Trump wants to punish rip-off big pharma. The world will pay the price, it says in its lengthy report. Well, what are the prospects for the industry, both in this country and more generally under Trump? Steve Bates, OBE, is the chief executive of the BioIndustry Association, trade body representing life science firms, and he joins us now. Hello to you, Mr. Bates.
Good morning, Adam.
How worried are you that Donald Trump has it in for big pharma?
I think it's been pretty clear that President Trump wants to see reforms to the American healthcare system and sees drug pricing as a big impact on many of his voters. And that's something that I think the pharmaceutical industry has been alive to and is seeking to make changes to in the US. I think the prospects for the sector are pretty strong globally. Unfortunately, we still are getting older, we're still getting diseases, and we've not yet found cures for all those diseases, but there's still strong demand for those when we are successful in making big changes, as was shown by the AstraZeneca drug that was approved in the UK for use in the NHS last week, TrueCap, making a real difference for breast cancer patients. But I think we're alive to the challenges that President Trump is making, and just as we've seen sectoral specific tariffs on steel and automotive, we're expecting to see them in our sector too.
Yeah, because he also sees this, as well as not liking big pharma, he sees this as an America First issue, and basically he wants to onshore a lot of the bioindustry work that's now being carried out by multinationals in this country and indeed in Ireland. Isn't that the case?
It's certainly the case that the American industry is a strong industry. Boston, Massachusetts is the center of the world's biotech industry. Many companies are on the West Coast as well. But the UK is on the podium in the Olympics terms. We're the third global cluster. And I think if you look at this as a balance of trade issue, or, are we freeloading on American expertise? I think there's things on both sides of the ledger. If you think about it, Humira, one of the biggest drugs, one of the biggest antibody drugs in the past few years, that has made an American company, AbbVie, most of its money down the last decade, that's a UK invention that came out of Cambridge. If you look at the big genomic sequencing company, Illumina, they bought a UK startup company many years ago called Solexa, and if you can say that at the heart of that very successful American company was UK invention. So I think I don't think that it would make much sense to cut America off from some of the sources of some of the things that have made it some of its great companies lots of money. And I think if you look at supply chain, making modern pharmaceuticals is very complex. And if you think back to the vaccines we had during COVID, Pfizer talked about how it took over 150 components from around 90 countries, to put that vaccine together. All of these steps are regulated. We're a highly regulated industry, you can understand, for human health reasons. It's not easy to make those changes. Now, I think we've seen some commitments already from some of the world's biggest players, Pfizer, Johnson & Johnson, AstraZeneca, to put more of their manufacturing capability into the US. But I think all of these things will take time, and global supply chains are needed for the globe, not just for America, as we discovered during the pandemic.
We have recently lost some fairly big investments in this country, haven't we, by AstraZeneca, and before that by Pfizer. Was that really anticipating sort of deglobalization, if you like?
Not really. I think if you look at the changes that Pfizer have made to their global footprint, we used to have a big research centre in Sandwich in Kent. That is now smaller. Novartis also used to have a research centre in Horsham. That's closed. AstraZeneca moved from the northwest of England. They could have gone anywhere in the world. They chose to move the HQ to Cambridge, UK, and they've gone gangbusters since then, grown very well around the globe, and now one of Britain's most valuable companies on the stock exchange. So moving to the UK for AstraZeneca or moving within the UK has been very successful. I think what we've seen is a change in the nature of the industry. These days, more than half of the drugs that are approved by the American regulator, the FDA, come from biotech companies, not your big names that you may have heard of down the years, but smaller players. And the UK has been pretty successful in developing that ecosystem of small companies that are then engaged with and buy and license with the bigger companies. So we're doing okay in that change, but undoubtedly the move by the global players from having research cathedrals situated on one site, we were predominant in that in the UK in the 70s and 80s. That's not something you see anywhere in the world these days. So we have changed with the nature of the industry. And it's true that the Irish industry have done very well in recent years as a manufacturing base within the European Union with very effective tax rates. And that's something that is at risk now with the competitive pressures of tax policy and tariff policy.
Is Donald Trump actually onto something? As we know, in this country, prices of drugs are kept down because the NHS is so powerful as a purchaser, whereas prices are much higher in the United States. So really, it's the American public, American patients, who are paying for the big profits of big pharma. That's true, isn't it?
It's undoubtedly true that a significant amount of the global pharmaceutical industry's profit is made in America. That is undoubtedly true. I think that there is that's not directly linked to the prices paid by American customers or citizens for their healthcare products. There's a very complicated healthcare insurance system in the US that's dependent on your job if you're of working age. They all have different rebates, and there's middlemen who sit in the middle called pharmaceutical benefit managers who can often waggle the prices or take a fat margin out of certain drugs. So I think there's definitely the possibility for there to be reform in the US healthcare system, a point made by people across the political spectrum in the USA, which is not the same as having an impact on the profitability of innovators who are taking risk in creating new drugs that are making a real difference for patients. It's possible to both have an effective market in pharmaceutical products and access for patients. We probably need to see both of those. They're not mutually assured destruction.
Because it's quite interesting, isn't it? I mean, Donald Trump is generally seen as someone who backs big business. But on this one, he is critical of big drug companies, partly, I suppose, because of the high cost to individuals, but also because perhaps drug companies made a bit of a mistake in the past of making it clear that they weren't fans of Donald Trump.
Well, I think that global companies are used to working with political regimes of all colours, flavours and stripes, and ensuring that access to medicines continues to patients throughout that. I'm not sure that I would agree with that characterisation. I think if you look at the funding that goes to American players, J.D. Vance comes from used to work in biotech. I'm not sure that that it's as simply as clear that life sciences is Democrat and President Trump is Republican. It's far more nuanced than that.
But there is a slight current of anti-science, isn't there, or more than a slight one, in the administration with Robert Kennedy Jr., for example, being made health secretary and talking about vaccinations against measles, calling autism and other criticisms of conventional medicine. That must be of great concern to your members.
Undoubtedly, the cutting of important regulators in the US, who are the people who check and ensure the safety of medicines, mean that there's been delays for companies in the arrival of new medicines, and that's unwelcome. The risk that there is now to universities in America around some of the science funding, where again their basic science leads to breakthroughs and discoveries, is of a major concern. And some of the things around blockages at borders or some of the arbitrariness in terms of people going in and out of the US in terms of immigration makes it harder for global businesses to be confident that global employees can go to important meetings. So I think those things are certainly a big concern of the life science industry.
Steve Bates of the BioIndustry Association, thank you very much indeed.